Um, Today we have Dr. Payne, who's going to present
Hello.
the topic of diverse clients, EDMR, Brainspotting. So please take it away.
Awesome. So, hey, everyone. I'm playing around with seeing faces. Sometimes it covers my screen. So let me know if it's interrupting what you see. I want y'all to have a pleasurable experience, but I like looking at faces. So yes, I'm Dr. Payne, and so thrilled to be here. I met, I think, Sasha maybe a year ago at a conference. And so uh, y'all had a roster full. And so I'm just excited to be here for this experience. So yeah, I'm talking today about counseling diverse clients. And really, I call this a discussion. There are going to be a few points where we might pause and just, again, that absorption of information, just see kind of what's sticking, what's not, what's landing. So moving throughout. So if you have thoughts or questions that come up, please put those in the chat. And then at some of those pause points, I'll open the chat. I'm just not great at multitasking. So if you do it during a point, I just may not see it, or I might have played with my screen in a way where I can't see that pop up. But just know there will be a couple different points where I'll pause and kind of look at it collectively, and we'll all kind of discuss before moving on. So that's the discussion part. I will be talking briefly about EMDR and brain spotting, two approaches I use in therapy. However, I'll mention it when I get to the slides. They are going to be brief overviews. So kind of like a taster. And mostly for the purpose of conceptualizing a cultural framework, social justice models. And so the idea is not that you walk away knowing, okay, I know about EMDR, I know how to do it, right? The trainings are super exhaustive for that purpose, but mostly if you can kind of see why these approaches might work with diverse clients, bringing yourself into the room and through talking about different models of lenses to view clients in that counseling relationship through. So with that, I'm going to move on to talking about myself, which sounds weird, but I've learned throughout the years, I sometimes forget aspects of my identities that do influence what I present. And so I decided to just make a slide to remind myself who I am. On the left, you'll see this is a positionality kind of statement I've started sharing in my classes. I teach at Western Kentucky University, assistant professor in their clinical mental health program. And so this is one way I've started trying to bring myself into at least the classroom in a different way, and hopefully to invite students to share what they're comfortable with. So they're not required to share it, but this is just a statement I'm working on. I was thinking about the relatively young part, might tweak that and kind of gracefully aging, right? I don't know. Playing around with that, just different words. But I've hung on to this for a while, just different identities that come into who I am as an educator, a counselor, and I said beyond, right? But to the right is kind of more of the formal identities and associate with my teaching, scholarship, and kind of agenda in that route, if you find that interesting. So I mentioned I'm teaching at Western Kentucky. Research topics centered around Black women and advocacy and wellness. I call that justice and joy, and kind of balancing that. Culturally safe spaces, BIPOC spaces, so that's Black, Indigenous, and people of color, and just the safety in those spaces. And I've already added some things because teaching kind of excites me, and I start working with students. So I'll probably revise the slide of how do we teach advocacy so it can be a part of that counseling identity. We talk about it in ethics, we talk about it in all these governing bodies we have. And so I'm working with some of my graduate assistants and some students, just kind of brainstorming that. They have a counseling graduate group that I'm super excited about. And so we're like, well, how about we pilot this, right? And so we're going to work on some grants and just seeing if we can kind of see how do we teach this, like working this muscle, right? Internship teaches you that clinical piece. But how do we kind of work out that advocacy muscle? So that has already changed the research area, because that's going to take a lot of my focus, because I'm just curious about what that'll look like. My clinical orientation, I come from, I say a cognitive, I know it's cognitive behavioral, and some people just debate separating those. I tend to lean more to the cognition part, but relational cultural theory, we'll talk about that today, and then brain and body-based therapies. So I found a really great connection between those. And of course, kind of pulling from all things, right? I think I'm a big believer that we've all kind of borrowed and repurposed and re-envisioned different things. But these are the ones I kind of land on most often. Cognitively, what are your thoughts, beliefs? Relational, cultural, how are we interacting with one another? And what do we kind of mirror in this counseling relationship? And then brain and body based, how are we kind of sitting with where is the trauma in your body, how that whole experience. So trainings, I mentioned EMDR train, BrainSpotting train in phase 1 and 2. I'd like to shout out, I was trained by David Gran, who's the developer of BrainSpotting for both phases. He worked with John Edwards, who championed this cause to have a BIPOC specific training. And so it was a unique experience in that it was really kind of exclusive to BIPOC population, because recognizing even in training experiences that BIPOC counselors were having these kind of oppressive experiences within the kind of training setting. And so that was a unique experience and my introduction to BrainSpotting. So that no doubt shaped my lens of seeing this kind of therapy as a tool for working with diverse clients. And then licensure, I'm a licensed mental health counselor in the state of Indiana. Live in Kentucky, pursuing that LPCC, also just hoping this compact happens and magically some of that paperwork is reduced, but a nationally certified counselor, approved clinical supervisor, and a board certified telemental health provider. All right, moving forward. So a little bit of what we're going to talk about today, not a little bit, we'll touch on all these areas. So starting from your left, kind of swooping down, we're going to talk about relational cultural theory. Again, I'm going to contextualize it to the points that I feel connect with these two different therapies. So it may not be a thorough overview. I get excited sometimes and I might pause somewhere. So I've tried to keep some of my slides simple, but you'll probably see when you see the slide that, okay, I had a little trouble editing down. But the goal is to start some kind of conceptualizing our work with clients through that lens. We're going to talk a little bit about EMDR and Brainspotting, like I mentioned, really some core tenets. So again, it's not kind of coming out with this is how you do this or being trained or kind of even an overview of what it's like. Mostly just pulling those components that really relate to conceptualizing our work with clients. Then we're going to talk about working with BIPOC clients, diverse clients. We can open that up to just multicultural lens and social justice counseling, and then a discussion at the end. And so, as I mentioned, there will be a couple points where we'll pause. And if you have thoughts that you're sharing, I'll kind of look through. But at the end, just an overview discussion. I always like to hear and discuss and questions. So, all right. So let's go into just talking about relational cultural theory, just foundationally. I feel like I've been introduced to this throughout my training experience without really knowing, just in my work and interactions with supervisors I've had over the years. So what I, have found and kind of looking a little deeper into why do I connect with this theory, it's kind of roots in feminist critique. And so I found a line between some of the research I did using Black feminist thought and darkened feminisms, that there's this kind of core theme of our connectedness with self, the individual self, but also connectedness with the community around us. And so I found that I really landed with relational cultural because that seemed to be kind of flow through, right, from its origins and kind of this idea that, yeah, we can move through as individuals, but we really can't disconnect from the impact we have on one another. And so I became really curious about that in the context of counseling. So I feel, because, this is my interpretation based on Miller's work and also the other collaborators I know she worked with and others who've kind of continued the work, is that I really feel like this framework can place the clients experience their personhood in context, but also the counselor identity into the room is how I said it. So this was my introduction to, I really can't keep myself out of the room, right? This kind of neutral stance that I think at times we're taught. And there, to a degree, a lot of the counseling skills, we want to be non-judgmental, and that means kind of neutral. This isn't good or bad. I'm not the judge of that. But as far as who I am and knowing that I'm going to have an impact on this client just by who I am sitting with them, based on their experiences, maybe what people look like me, or lack of experiences, right? Or just the connectedness we might have in identity. So just noticing that this seemed to align with how I view the counseling relationship. And then instead of moving away from that, embracing that, how do I bring that into the room intentionally? So I shared my positionality statement. I share in my classroom with clients. It could just be introducing myself and adding that component, or just saying, I've had supervisors who called out kind of their parts of their identity. And for me, when I think of that, the growth I was able to have as a developing counselor, because they started out by saying, hey, I'm a white woman, you're a Black woman, and just calling out the dynamic, right? It didn't have to mean anything then, but later on when conversations came up, I felt like that door was already open. So again, I didn't know that's what was happening then, but I just appreciated it and had some conversations where I was able to share, hey, this feedback felt this way. Or, I remember having a white male counselor. He said, I'm an old white male. I'll quote him because I'm sure he could be tickled that those were his words. But honestly, again, just starting that supervisory relationship later on, when I was able to kind of sense that some of his feedback once was, it seemed like he said that because I was a woman and not necessarily right. But I was only able to do that as a supervisee in that position under him, right? Because he opened the door. So I think relational cultural theory kind of can open the door, or at least that framework lens of us noticing if there's some of those, even if we don't perceive it as a barrier, anything that could be in the room, if we call attention to it. Yes, I see a hand. So I do have y'all on my screen.
Yeah. Okay. So question,
Yes.
what about, you explained nicely about what was possible because of the old white guy opening the door. What about being explicit and direct in inviting the person you're speaking to, if they, first of all, making sure that you yourself as the counselor you notice and check out any assumptions you may be making. The noticing part is really hard, I think. And then on the other hand, inviting, if and when they are ready, for our client to do the same, and to assure them that they are in a safe place, and that if they, are noticing something, feel free to ask about it or share it, I mean, like really just directly saying.
Yeah, I think there's so many ways to do it. I think I like your word invite, right? Because that gives choice. And so I think I've seen it, multiple ways, where it's kind of, if I open up with it, right, we'll talk a little bit about vulnerability, or that's a component, right, of some of this. And I like to think, as much as I'm willing to be vulnerable, that shows them. So I could say it, but I also want to show them, because I think just even using my own experiences seeking counseling, someone could say it, and I've had counselors not get it really, right? And so where I didn't feel safe talking about certain issues, and where I felt like I had to keep a part of myself out of the room. And so I think both and, right, the very direct, but also I think the other approach is kind of has this humility, right? Because they both came at me of like, I know I'm in this position, and they really held those roles. I don't want to mistake anyone that it wasn't like they were like, hey, you direct this. Like, they were my supervisor, but them inviting that conversation, it felt like it came from this culturally humility, right? Of just like, but I'm not going to know everything, and there might be stuff I say. So in a way, they weren't promising that I was going to be safe, but they did open the door unknowingly to me, right? But when things came up, I was like, oh, this is not going to be a surprise to them because they started the conversation. So if I go like I did to that one supervisor and say, hey, when you said this in front of the team group that I led, right, it made me feel like it was coming from this place. So it wasn't accusing him of anything. It was just showing him, hey, this vantage point that you admitted that you may not see with me, I think this is one of those situations, right? And so I think maybe it gave me trust that he would even receive it, because it wasn't a shock to him. It wasn't something I had to, as a supervisee, bring to my supervisor who's signing up on my hours attention, right? It was kind of like, hey, this is almost like this conversational flow. Like you said, this invitation, this door is open. If you want to share it today, you don't have to. I just want to share who I am, right? And so that might linger, I imagine, with clients to feel like, oh, it's not a shock to them if I bring in this other part of my identity. And maybe they don't understand, but they already admitted they may not understand. But the goal is not that they understand completely my experience. But right, to me, I think what I heard in those brief statements from those supervisors was, yeah, I'm noticing this, right? It may not be a thing, but if it is, like you said, come to me, right? Talk to me. And so, and I was able to take them up on that. And that, in fact, built more trust. And so that I realized that's not everyone's experience with supervision as well. But I was really, really blessed with that, because it really just kind of, I think, helped me have a lot of difficult situations, even with some of my biases as they came up when I was working with clients, right? So it went both ways, where then the supervisor, right, could push a little harder. Like, hey, what are you doing? Are you asking everyone this question, right? Like some of my things came into that supervision setting because it was already established that, whoa, okay. Like you said, it is hard for us to notice. I think that is the hard part. So I think both, and I like the modeling aspect. I'm going to show you, but also I do believe in the direct. Like, I'll tell you, like, here's what I would like you to feel comfortable doing. And if you don't, let me know why. But I think they'll look for evidence that you can take feedback or little things like that. Great question. Yeah, so I love this already. So, I knew I was going to get lost here. So we'll move ahead. I'll be sure to send slides, and I know this will be recorded too, but I want to talk about the neuroscience and connection. So really, I'm going to read this quote to center myself. Relational neuroscience has been showing that people cannot reach their full potential unless they are in healthy connection with others. And so I'm kind of taking this to build off of the premise that I've been moving towards a philosophy of we really are interconnected in a lot of ways. Even those we have conflict with, they're kind of, if we allow it, we can let it show us something about ourselves, or why is that rubbing me? And so when I first think about this kind of idea of neuroscience and learning about mirror neurons for the first time, I'm like, hey, when I'm sitting with someone, like there's an exchange happening, versus like a little unsettling, like, quit it. I don't want to share that with you. But as I settled with why it was resonating with me, and why I loved being in the room, and I can get some of it virtually, and kind of working hard to be present in that way. But just this idea opened up for me again, that counselor role, like who I am is impactful, right? Being here, being a listening person. I found that it helped me not focus so much. I saw a hand and I think it went down, but I'm not going to forget. But it helped me kind of center in my counselor identity in a different way. So yes, we're learning these skills. And then, right now I'm teaching an ethics class, so they're all just freaked out about just not messing up. But it's like at the core, right? If we are solidified and this person chose to see me, like there's a connection here. And just going to certain experiences I had where I had no words to say, I couldn't find a worksheet, right? Like just in the moment and sitting, and then afterwards reaffirming, like, whoa, but they came, like, right? They just failed a test, they came to see me. Someone just passed and they came to see me. And I remember those freak out moments, like, well, why the heck are you here? But then just sitting and not feeling like filling the space. And so I feel like it really helped me with that. Like there's something soothing that I kind of just bring, right? And we add the skills to it and can walk folks through, and these different approaches help us with that. But at the core of the identity, when I was able to find that, I was able to let clients go who weren't a good fit, right? Like it just helped me in so many ways where I wasn't forcing things, where it was like, there's this connectedness that happens and I may not know how to explain it, but if I can center in that, then I can be so in tune with how to work with a client or work with them, or, you know, even through even difficulties they may have, or if they confront me on something, right? Like it just gives me that motivation. It doesn't go back to, oh, I'm a horrible counselor, right? Which is a monologue that played for me for a while, or just feeling I'm not doing it right, or how do I know, and all these kind of things. I was just more settled in my identity. So when I think about relational cultural, and it talks about mutual empathy, and there's a lot of words like mutual, right? There's this exchange. Relational is a big part, and just understanding our dynamic, what we represent to our clients. And so I just wanted to highlight that piece, that connection piece, combined with what kind of research is saying about neuroscience and, you know, the physicality of how we connect with others, but also just our presence and how we sit with clients. So Melissa, I think I saw your hand, and it was a while ago, so I'm sorry if you lost
Yeah,
it. And then
you did see my hand. I just wanted to bring another aspect to what you guys were talking about when the guy said, you know, the supervisor said, hey, I'm an old white guy. Because from a neuroscience standpoint, it's quite interesting because there's these built-in assumption type things. In other words, if I were to meet you and say, hey, you know, I'm not black versus, hey, I'm just, you know, I'm white.
yeah,
It brings a very different reactional dynamic, because it's almost like sometimes, you know, that hey, I'm just this kind of all has a presumed apology in it, maybe, or an excuse, you know, versus from a neuro standpoint, it's like, how do we support a healthy curiosity?
I love that.
And
Yeah.
and you know and so to say I'm not this almost is to say, hey, I don't know this, but I'm really curious, you know, I'm really open to finding out about it. And so, you know, I guess I find it as maybe an interesting possible reframing that should be taking place, or could be helpful in a supportive, positive way to how we interrelate and connect with each other. You know, in the, hey, you know, I'm this versus I'm not this, but, you know, I'm open, right? So
Yeah.
that was
Yeah.
just my observation or thoughts on that.
I appreciate that. Yeah, I feel like my only thought would be trusting that person who's leading that conversation to pick it, knowing who he is and knowing who he is even now, you know, to him, I don't have any question that he feels like he's just, or like that identity. I think it fit just his personality. So I would say that would be, to add to your consideration, like, I think there's still power in leading that without feeling like I've got to identify what I think, because there's an assumption I'm not black. Well, I might be African, or all these other things. So you're having to kind of step out and identify the other person instead of just saying, here's who I am. So definitely do it in a way that's free and not feeling like I'm putting myself down. But I think it was more about calling attention to his identities.
Yeah.
Again, the way I've adopted it, because I'm just right. Like I don't add that apologetic piece that you were talking to, because I think that is key. Our words are powerful. I think it's just, here's who I am, right? And for me, this is part of my journey, is staying connected with myself. My dissertation was about fragmenting myself as a Black Christian woman in academia, that with all these internalized stereotypes. So I looked very much inwardly to, what are these things that I'm adopting about myself that makes me leave parts of myself, and it the different tropes that just kind of really came alive that were detrimental. And that's kind of where I took off with the wellness and advocacy. Like, can they coexist? If I'm fully myself and these things are happening, but can I also be well? And do you give up one for the other? And so I definitely want to echo your sentiments of like, yeah, we're not inviting ourselves in this kind of lower place, right? And that was kind of how I started my dissertation. first title, this is a tangent, was going to be The Sunken Place. And then worked with a coach, and then it became In Darkened Joy. Because again, this joy came up where it's like, yeah, right. That was the struggle narrative that I was so used to being associated with Black people. And I was falling right into that. So I agree, like being careful with our words, that we're not adding things to it to feel like, oh, I'm apologizing, but this is just who I am. So my statement to my students, that's just who I am.
I hope that with this is just who I am, that again, that, people have the healthy curiosity to say, well, maybe I know what, given that title, maybe that I understand who that is, or maybe I should ask more about, so because it's a journey, right? But I like your positive spin on the sunken versus the more positive.
I'm glad I changed it too, honestly. Laura, and then if I missed a hand, sorry, earlier. Is it Kachin?
Oh,
Kachin? Tell me how to say your name and then share. I think you waved your hand and then I didn't register it, and then we'll go to you, Laura.
It's okay. It's Cation. It's okay. I just smile because I like to see people struggle with it, but it's Cation. Cation. I don't know if it's too much in advance, but I was intrigued by the RCT goals. Number 2, I've been kind of fixated on it and picking up the nuances the way I interpret it, but I wanted to get from you how you saw remembering relationships, relational and controlling images, how you conceptualize that.
So I added that in. That comes from In Darkened Feminism with Cynthia Dillard's work, which I based my whole dissertation on. It added the spirituality component that fit with me and what I needed to explore. But she used this kind of remembering to represent kind of going back and like piecing yourself together. So I just took an opportunity for this because, we're walking clients through remembering and kind of walking through past experiences. For me, I just see that word that way now because it just represents like the double meaning. So remembering as in memory, but remembering, piecing back together. So that's what that means. And conceptually, that's how I look at that. Like someone mentioned journey just a minute ago, right? Like this is walking through and we're piecing it. It might be fragments, right? We're all kind of trying to collectively get to this whole self. But part of kind of going through and doing some of the work I do, trauma work or working with clients specifically on stressors, acculturation stress, things like that, where they're in an environment where they are fragmenting all the time, or people call it code switching, where you have to change how you talk, right? You're surviving. And so for me, when I saw that, and then in 3, disconnection, it could be disconnection or connections, right? And just starting to look at these pieces coming back together is not always a clean cut of it's either this or that. Sometimes it's really mixed together. So that's just kind of come from my throwing it in darkened lens on top of RCT's goals. Yeah.
Thank you so much.
Yeah, thank you for that. Okay, sorry. Now back to Laura, and if I missed any other hands, I kind of am toggling between seeing everyone or just.
Well, one is welcome to How We Are and good luck getting
your
material. But
I love it.
I wanted to just share an image that came into my head when Melissa began speaking. I don't know if any of you guys remember this, but there was kind of a social media conversation when people were using those little things. What are those little things, to like, where you had choices about what color the thumbs up would be.
Okay. Yeah.
Those things. And people who would choose not matching who they are. And that's just what came into my head when she was, I don't know if you remember, that was kind of the big conversation, like, wait, what does that mean? That I know you're a white person and and, or, you know, or I know you're a person of color, dark color, and yet there's this disconnect. What is that about? So I just wanted to share that. And I don't want to talk about it because you'll never get done.
I appreciate this invitation to exploring. I love it. And so, yeah, if we can mutually share that responsibility, I get lost in this. I love it, these conversations. Yeah, I don't recall that actual kind of when that happened, but yeah, just curiosities, right? I think to Melissa's point of ensuring that we are, even as we recognize maybe differences or that humility that we want to come with, making sure we're not downplaying ourselves, because that doesn't help anyone either, right? And so a part of the Dark and Joy frame, right, like is being able to be your whole self, is that wellness part, and making sure we're not negating a part of that to connect. And so I want that to be loud and clear, because I think that's a very great message. We don't put ourselves down in order to connect, right? It's just, we connect just by nature of being in proximity, right? And it's how we choose to look at that. So we will move forward, but I'm super excited. So that's a brief overview, not even really an overview, but these are the connecting points that I want to bring as we talk about EMDR. So we're going to start with EMDR. Again, this will not be even really an overview of the method. I was trained in the 8-phase model. I'm sure there's different variations now, but that kind of walks through different components, right? There's some history taking, there's the kind of relational development of kind of how we build rapport and teach some stabilization skills before you get into the processing. But I think if I can share the slides or with you, Sasha, I don't know if you send those out. There is a hyperlink to a handout if it works, but if not, in the sources and things like that, you can go to different sites, but EMDR's International Association, that would be a great place to find information. So EMDR stands for eye movements, desensitization, and reprocessing. The component of this, right? I don't know why the video is not playing, but I just love visuals. It kind of helps excite me when I'm working on finishing presentations, if I feel like there's movement or something happening. But it's really just this woman kind of hugging herself. And that just takes me to the part of EMDR where we really build this kind of self-coping. And one of those are called, I think it's kind of angel hug or butterfly hug. There's a couple different options. So I just found this of her kind of embracing self, but this represents kind of this touch component that I found to be very helpful, in addition to just the practice of EMDR that works a lot with eye movement as the bilateral stimulation. So I won't go much into that, but really just this back and forth motion is how this approach originated. But folks are finding that there's really bilateral stimulation can happen in a lot of ways. So I have clients who wear headphones and there's sound that goes back and forth. You can find tracks that kind of move, not like at a certain rhythm, but just kind of flowing from one earbud to the next. And then touch, right? So I add a tapping component with my clients. So I feel like that part, I see a response, especially when there's a shift in session. For me, and what I've observed, and even my own practice of receiving, EMDR through training and kind of remembering that experience, is just the touch component as that other point of connection to self. And also kind of mirroring it. I often do that with my clients where, okay, if I'm leading them through that, I'm mirroring it right back. And it calms me down. I was like, well, this is a no-brainer. If I have any stress, right, I get to be present in the moment, but also just mirroring, another way of just being connected in a different way as they're kind of settling into the moment, or maybe we found a part of session where we're going to pause, or a new realization that came up. I mentioned cognitive earlier, and so I work with the EMDR model that brings in core beliefs, and so usually there's a core belief we're working through towards turning into a more adaptive belief. And so those could be those moments to pause and add a kind of physical connection as we're kind of I think someone mentioned reframe, Melissa did, reframing, right? And just the importance of some of those messages. And so that just kind of as that component. So the stabilization part of this model, I want you to hold on to as you think about what we talked about briefly with relational cultural. Consider any parts of EMDR or BrainSpotting that you hear that feels like, okay, this seems like I could see how this would work with that relational component. EMDR kind of works towards this integration. So again, this kind of wholeness of self. So we process the past, the traumatic event, and there's a system of how we identify what those events are. But it's really, you know, we're not kind of saying, hey, we're going to erase that. We can't erase it from their memory, right? But it's mostly, again, going to what is a belief that could serve you now. And I know with a lot of clients that I have found helpful is even having this way of talking about the past in a very loving, kind way. As in, I did what I had to stay safe, right? Those could be one of those thoughts that we come through. So the thought doesn't have to be, I'm safe now all the time, right? And I really try to help clients of like, okay, more adaptive could be, right, recognizing you did what you could then, so we can look on that with kindness, or even as their body responds the way it does, instead of frustration, recognizing this makes sense, or my body's just trying to tell me something. So big resource that everyone, you know, talks about, I shouldn't say everyone, but that I read about, that was a really helpful tool to even tell clients about, was The Body Keeps the Score. And just, again, as comfortable as I was with this model and bringing myself into the room, I feel like it led to those, staying in some of those conversations in session a little longer when clients wanted to move away from noticing what's happening in their body. A lot of this approach kind of brings them back to that. Where do you feel that right now in your body? So just highlighting these kind of aspects that even as we're delivering these methods, our understanding of where we hold things, I feel like mine grew. And then I was able to connect with clients more because I knew it's uncomfortable, right? I could kind of speak from experience sometimes of like recognizing if they were resisting or if they were shutting down. It's like, I don't feel anything. Okay, is this feels like resolved, or does this feel like numbing out? Right? Like, help me understand where you are right now. And so again, it kind of helped us very much tracking together, which is what I like about this approach. So keep that in mind as we're thinking about mostly how these would help with working with diverse clients, but also bringing yourself in to that relational experience. So similarly with EMDR, BrainSpotting, we're just going to look at a snapshot of some of these kind of tenets that popped out to me considering it. Towards the left, top left, I call it this kind of embodied resource model. There's so much connection between both of these approaches that really pay attention to the body. Like I just mentioned, of just where do you feel this in your body? I'd say BrainSpotting really kind of has built in a resource model to sit with your body as a resource. So I'm being repetitive because I love this so much. So I'll probably have to move through it quickly so I don't stay here. But teaching that as a resource, I think, is where I was able to grab those insights as before, as your body is really a tool, right? Like we don't have to hate it. Yeah, maybe did some things hard on our body, or we had to do some things to protect ourselves, so we get tense in moments, but it can be a resource. So the same way we feel all this distress, can we use our body as this centering piece to kind of help us? The more we get connected with it, not run away from it as we're working through trauma, that we can kind of have this experience to move through healing, or look at it as a signaling device, or look at it like, oh, you're telling me I need to relax, or I need to take some stuff on my schedule, right? And so how do we use it as a resource? And BrainSpotting has a setup that helps us kind of identify that. Everyone's different. It could be different every single session, but you just kind of set up with that intention, as opposed to thinking of something distressing, which some of the other setups help with. This is with the intentionality of, where do you feel the most grounded right now? Let's just kind of sit with that. And again, the focused attention, using the pointer to identify eye locations, similarly to EMDR, except it's one fixed location usually, right? You can move it around. But that's that kind of still that focused attention, bringing in a part of your brain that has to kind of activate to do that task as we're kind of focusing on something that typically we move away from, or we don't really sit with long. BrainSpotting also has this uncertainty principle. So this is something that I've really, again, adopted that has just been very freeing for me as a counselor practicing. This idea that I really don't know, right? And so we're on this journey with the client. EMDR is similar in that it has that kind of, hey, just go with that, depending on who you were trained by, right? Like there are these phrases, and it was just so liberating. It's like we weren't trying to figure out as they were processing. It was just like, okay, go with that and just keep going in. So we weren't pulling them out of process. But what that did for me was keep me in this, I don't need to know really the connections, all the connections their brain is making. If we see movement, we can check in. There's different ways to do scaling. Again, people check in with the body, where we started at the beginning, how do you feel now? Different ways that we can track, right? But it really isn't about them telling us everything that's coming up. And I've had clients really move through some powerful things that I had no clue of. I was just holding the space and literally holding the pointer, but that was a reminder to myself that me being here is essential, right? I'm a part of this connection. It's not how much I'm talking or all the interventions I'm using. It's this kind of focal point. I am with them and they know I'm with them, right? And I can guide them through it, but really it can be a humbling experience to just kind of sit as a client is processing. So that uncertainty principle is just embracing that we don't know all these things, and that really the client's brilliance is what we want to rely on. And we're just attuning with them. I see something happening on your face. Can you tell me what's going on, right? We notice for them to call out that they are doing the work, right? And so that kind of helped me. If I did interject or bring something in, it was from that observation and not a task that I wanted to move them through. I want you to get down to a 0. I need you to be, all this kind of stuff, which obviously we don't want our clients in distress, but it helped me let go of, I don't know why they're crying. I don't know. It looks like they're getting more upset, but I can check in with them because maybe that is what they need to feel, right? Where I could be uncomfortable seeing that. Whereas they could see, no, I want to keep going. And so there's ways I check in with my clients to help them say, hey, is this feel you want to keep going with that? Like, where are you at? They know they can stop and pause. And sometimes they say, no, I want to keep going. I want to see where this goes. Yeah, Melissa, I see your hand.
Yeah, as you talk about that, it's so interesting to me what you're saying, because they do. I went to a presentation and I've learned quite a bit about people who use horses to do therapy, and the whole thing is the horse, is so very attuned to your heart rate, to your breathing, to that it's and you talk about mirror neurons. I mean, basically it's registering incongruency. Essentially, it will react to that incongruency from a what threat is here, what's uncomfortable thing. And as you talk about that, and so the idea is for you to work with whatever you're doing to get to a place of congruency, so the horse will do what you're asking, or mirror that in kind. But as you talk about that, it's so interesting, because I think that's kind of what you're tuning into is, I don't have to hold all this stress or anxiety about like, oh, I'm trying to figure out what's going on here, because again, that's more about incongruency. But so when you bring yourself to that place of like, I don't have to figure this out, I can let the client do it, that it gives them the space to bring that balance back in the same way. So it's, how do I get in tune with my own emotions to bring it to a place to mirror or reflect, emulate what I want them to, where I want them to go to.
Yeah, I love that. I mean, even as you were talking, the calmness, like I just felt hearing your words again, because I think for me, it kind of put it into words of like why that's so important. Because really me trying to figure it out is going to then come into the room, whether I want it to or not, and the frustrations I feel, or they're not right. That's when you start to see all that. But when I let that go, and when I'm just okay being me and being in the room, then I can attune in such a different way. Then I know what I'm sensing is maybe what I'm sensing from them, and it's not kind of my stuff, because I kind of let that go and let go, trying to figure out there's not this time clock. And like you said, yeah, the space. And I feel like clients notice that. They notice when they have room and when
Yeah.
they don't, right? And so the surface level stuff can come up. It's like, I don't feel like there's room, or the, whoa, there's a whole maybe hour span where 30, 40 minutes of this we were processing, right? And it's like, that feels like space, right? Maybe too much space for some clients, but it's like, okay, that makes me feel like I can go into these rooms or these areas that I maybe haven't, than if it felt like, I don't know when time's up or when I got to shut that down. And right, like both of these models have the way of how do we stabilize after, and I walk clients through that. I'm not just going to leave you in the middle of processing. But yeah, I think if we can be, I think you're right, like they will pick up on even our settledness. I'm like, okay, I can go to some of these areas because we don't have two people now with all this stuff going on, these competing interests. So yeah, I love how you put that.
Thank you. Yeah, very interesting stuff. Thank you.
Yeah. Dual attunement, we were just talking about that. So it goes both ways, exactly what Melissa was talking about with the horses, like just we are attuned together. And so BrainSpotting centers that dual attunement frame, the role of the therapist and our client, right? Both of us attuning to one another is essential. So this is a slide that has a lot, but on the top is really how I started to summarize maybe what was I taking from that framework we started with, relational cultural, and how was I putting that into looking at my work with clients through a cultural standpoint, through anti-oppressive stance, through my own positionality, all these things we talked about. And so really I just put some things towards the bottom, but if we look at that image on the top, these fancy icons from Canva, so I can't take credit for any of these, but the focused attention, right, that represents the BrainSpotting and EMDR, both have components of that, right? Both of them have components of using the body as a resource. And then we have that idea of remembering, right? We're taking them through with both of those approaches, have this kind of neuroscience background of kind of, okay, we're going to a place, and sometimes that's past trauma or processing distress. So that calls to attention certain distressing events, which is a kind of remembering. And then this last image, the connecting. And that's how I kind of conceptualize all this together. Essential, all these components are present in both of those, but the connection piece. And so when I think of working with, I remember a class, I wish I could remember the instructor, but crediting them of like really every client who sits in front of us is a diverse client, right? And just even if outwardly or certain aspects of what their appearance might seem like we share identities, we really don't have the same experience. And I learned that myself as I was going into supervising and working with a Black woman. And I think I had, well, I don't think, I know now, I had a major blind spot because I was thinking, well, she's going to be comfortable coming to me. And so didn't do anything. My supervisors taught me that I praised earlier, right? I was just like, okay, she's going to be comfortable, so we can just talk business, I had such a difficult time connecting, or she wasn't submitting things to me, or it was like early in the morning, I was just trying to figure out why won't she let me help her, like, right? We get to the end and I get history that I should have gotten before about two previous supervisors she had that were Black women. And so she had these negative experiences that were just ingrained in her, right? With that actual relationship. So it was like, it needs to be perfect before it gets to you. I was not picking up on any, I was just like, you're not turning it in, so I can't give you feedback, right? Like it was this loop of, and I just missed it. And so I presented with a colleague who had a similar situation culturally, of like talking about these cultural blind spots too. And so really it took me back to this place, we have to just stay open and curious. I think that was a word used earlier of, yeah, I could think I know, but I really don't, right? And so there might be areas I think I'm going to connect with a client and it's something else. And so keeping that humility is going to be huge for working with clients, and trusting the client, right? Going back to embracing uncertainty. The things I might think I know, maybe they even confirm some things, right? But I still don't know. And so I still had to be curious every time, every journey, every moment in session of, okay, I think I may know why that's happening, but let me ask them, let me be curious, right? We talked about some of the theories, relational cultural. I'll kind of move along through this because I want to open it up. I see some chats. I don't see them now, but I see them popping up. The anti-oppressive stance, right? I didn't talk about this a lot during the talking about RCT, but I think what it kind of coming from that feminist background and understanding the role of the power dynamics. If I probably would have went into a whole thing, and that's probably why I didn't talk about it, but right, it was on one of those slides of power and balance, and like bringing ourselves into the room also means that we have to be aware of what we might represent, and that kind of staying aware. I think someone mentioned earlier, doing that self-introspection, not only for the biases and things like that, but also making sure in our counselor role that we don't step into that oppressive stance. I know what's best for this client, right? Like it's so easy to pivot. And so there are parts of our counselor identity that kind of can align with that if we're not careful. And so part of this approach that I really adapted is because it has so much of that removing that part of our knowledge out of the room. It's great. We have it. I'm trained. It's great for us to be trained. I want y'all to hear me say that. And at the same time, I know nothing, right? Like this kind of idea of I still have to enter the room. And that is one way, a protective factor of making sure I'm not becoming an oppressor in the role of a counselor, right? It can have nothing to do with your cultural identity, but just the stance of I'm in this role, and clients are going to see it as a position of authority, whether we view it that way or not. And so keeping that kind of mutual interest, that mutual vulnerability to a level that is comfortable, right? I'm someone who doesn't believe self-disclosure has to be said, right? There's other ways. And so I'm not saying we have to, again, connect in all these different ways, but I think it's more the posture of humility and how we work through with clients and what we consider success, even making sure we're kind of running that through this anti-oppressive lens. Am I saying this client is difficult because there's something underneath this that says they should be doing what I tell them to do? Or is the fact that they're coming each week a success, right? Like just recalibrating some things to fit. For me, relational cultural helped me kind of take away some of those outliers. I know some people maybe here or maybe even watching might have an agency they work for where they are, assessments and these standards, and find a way, if it more aligns with you, to kind of say, okay, that's one way of tracking, right? Because we can get fixated on certain things that I don't think even serve us as counselors. So noticing the time, I am going to pause. I said I would pause. And oh, look at this. We are at discussion. So I'll pull up the chat, and then you all are free to unmute at this point. Hopefully my chat box is not. Okay, this is registration link, just who I am versus who I am. Okay, so that word, yes. Thank you for that. And Laura, I hope I'm saying your name right. I didn't ask you. I apologize. So yeah, I noticed I did say that. So that's a good call-in for me to notice and sit with.
Actually, I didn't hear you say it. I heard someone else say it. I mean, maybe you said it.
I might have, yeah.
I would like to share just a teeny bit.
Yes.
How I learned, you made such an important point about how words are, they are so imbued with meaning, and we have no idea in most cases what that meaning may be for the other person. So I like to take pictures of birds, okay? And I noticed that if it was a more common bird, I think, oh, it's just a robin, okay? And that, in fact, robins are really freaking cool. They all are. And I could feel that it was diminished. Is that the word, diminishing? Or no, that's not exactly it. But anyway, and then I noticed every time I say the word just like that, whether it's even myself, it's a put down.
Yeah.
And So I really have radar about it when I hear my clients minimize themselves when they use that word just. And I do think that even if it usually isn't intentional, or even there may not be awareness of it, but I definitely think there is a neurological experience that the speaker says, and that the hearer, when the hearer hears it. It's one of those words,
Yeah, I appreciate that. I'm always welcome to sitting with things, so that's some work for myself. I did my whole dissertation was on internalized